Do you have lower back pain? Are you experiencing tightness or stiffness in your lower back? Today, we're going to give you a plan to address those symptoms. Hi, I'm Daniel Giordano, doctor of physical therapy. About 80% of people experience low back pain, and about half of those people spend most of their day sitting. Back pain can also result from overstress, overuse, poor form during exercise, being overweight, stress, or other medical conditions. Today, we're going to address those symptoms and give you a plan. So we're going to use a foam roller first to just work on the soft tissue. We want to increase blood flow, circulation, and really just soften that tissue around your back. So the first one we're going to do is we're going to get the glute. So Cameron's going to slightly lean his weight into the right side, okay? That's where we're going to work that right glute first. Yes, we're going to do these on both sides, but today we're going to start with the right glute. So he's just going to go up and down very slowly, okay? Really working any of those restrictions that you feel, any pain that you feel. If you do feel pain in that area when you're on the glute, do not stay on it. Move side to side, get on it and off it just to increase blood flow and just start to relax the tissue a little bit, okay? And you can see here, Cameron's going side to side as well. You don't want to just go up and down because you want to hit the fascia as well. We want to make sure that we're hitting all angles. So we're going to go side to side just to loosen up some of that tissue and just soften that tissue around the area. Now we're going to transition to the quad and we're going to work the soft tissue for the quad. Come over onto your stomach and we're going to place that foam roller right underneath that quad muscle. Okay, right at the front of that thigh there, okay? One of the things that we want to make sure that we're doing is we're going all the way to the top of the hip bone because there's a muscle there called the TFL muscle, the tensor fascia lata muscle. And we want to make sure, because it is a hip flexor, that if it gets a little soft, a little work on the tissue, just to mobilize it a little more, get more blood flow, more circulation back to the area. Just like the glute, we're going to make sure we go side to side, not just up and down. So we want to get any restrictions associated with that area and make sure that that tissue is very soft. Because like we spoke about earlier, if you're having some tightness in your quads, your hip flexors, it could cause some compensation into that lumbar spine. So we want to make sure that he's going up and down, side to side, and just soften that tissue around that area and increase the blood flow and circulation. So after the soft tissue work, we're going to work on mobility of the joint. We want to make sure that the joint is fully moving through its proper range of motion so that there's not excessive load on the lower back. Cameron here is going to start with a lumbar windshield. What we're going to do is come into the bridge position, lying flat on the ground. His knees are going to be shoulder width. But his feet, we're gonna make him put a little wider, okay? Just so that we get the full range of motion. And then Cameron's gonna start just dropping his knees side to side. So a key with the lumbar windshield is that if you feel a restriction, let's say here, and that's all you can go, that's fine. Be consistent with the movement. The more that you do the movement, the more this will improve. Just go to your end range, but do not go into pain on these movements. So Cameron's gonna go side to side, maybe about 8 times on each side, just to increase that mobility and just to take some pressure off that area. So the next mobility exercise we're gonna do is a cat-cow. So we wanna make sure that the spine is moving properly and safely. Cameron's gonna demonstrate that cat-cow. Hips are gonna be stacked over the knee, shoulders stacked over the wrist, head in that neutral position. Okay, what he's gonna do is gonna lift his stomach all the way up, like that cat, tucking the head underneath, just making sure that there's movement going through that spine, top to bottom. And then he's gonna come down, go into that extension phase, and looking straight up. So this is just for the movement of the spine. We wanna make sure that that spine is staying mobile and moving properly. So we're gonna go through a bunch of these, just up and down, make sure that those hips are stacked over those knees, shoulders stacked over the wrists. Your head is moving with your spine, tucking under so that there's no pressure or excessive force in certain areas, and then coming back up. Recommend doing those about 8 times or so, just to increase the mobility of the spine and make sure everything's moving properly. So the last part of this fix is the stabilization. So we work the soft tissue, we got the tissue mobilized, we move the joints through their full range of motion. Now we're gonna stabilize the tissue so that everything is strong, compressed, and there's no pressure on your lower back, okay? So the first thing we're gonna do is a core activation. So we're gonna come into a plank position. Okay, this is a modified plank position, so Cameron's on his knees. He's got his core tight, slightly lifted to that position so the core is staying neutral. Slight tuck, tiny bit right there, just so you activate the glutes. Cameron is gonna put his head down slightly to get that neutral spine, and then just really focus on pushing the chest away from the ground slightly, and then keep the stomach pushed a little bit away from the ground to get that core activation. With these planks, I recommend starting with about a 15-second hold and moving to about a 30-second. Once you can progress from there, move to 45. What we want to do is really isometrically contract that core position so your body understands that movement and stable position. What we can do from this position is go into a full plank. So you're going to lift the knees off the ground, tighten your quads. Make sure you do not keep your quads loose. We don't want to see a bend in the knee. Tighten that glute, really tighten that glute. Lift the stomach slightly away from the ground. Push through your elbows, lifting the chest away from the ground as well, so you get a full stabilization from head to toe. Push through your heels so you're coming back and keeping that core as stable as possible. Same thing, what we're gonna do is work on the compression forces. So if we're stable in that isometric position, your core can be able to withstand any forces around it as you move or sit during the course of your day. So the last part of our fix is gonna be hip activation. We work soft tissue, we mobilize, we stabilize the core, and now we're gonna stabilize those hips to keep that pelvis solid so there's less pressure on the lower back. What Cameron's gonna do today is show us a banded bridge. So we're gonna put that band on right below the kneecaps, get your feet about shoulder width apart so that there's force of pressure out here on the band so the band is taut, it's not loose, okay? Cameron's gonna focus on pushing through the heels and lifting the butt in the air. When we lift into this bridge, it's important that we don't hyperextend the back, meaning coming up too high. We don't wanna have excessive range of motion there. We wanna stop so that there's a straight line from the knee, the hip to the shoulder, keeping the core tight. Once you feel that, come drop your butt back down and repeat. We'll do about 8 to 10 of these pushing through your heels, so you're activating the glutes, getting those hips activated, the core activated as well through here, so it's stabilizing, taking pressure off of your back. That was our fix for low back pain. Make sure you're consistent with these. Spend 20 minutes of your day going through this routine. Those 20 minutes will help with your body awareness, your movement quality, and help decrease that pain so that relieves your pain long term.